Welcome to Contact Point, James. Lovely
Thank
to have
very
you
much,
on.
Simon. Thank you for having me here.
Obviously, we've known each other for many years now.
Yeah.
And actually, just reading through your bio and doing my research ahead of the interview today, I saw many similarities. I think in our journey over our careers.
Yeah.
And I think you've always been ahead of the curve in many ways throughout your career, whether it be through like branding at Bolane, or obviously with your various books, and then more latterly, obviously with Optimal. So yeah, really excited to have the chat today and hear a bit more about the journey.
Thank you for inviting me, Simon.
No worries.
There's a polarity. I was reading your bio on the way.
Oh, there you go.
Like, what have I missed? Oh, wow. Okay, I didn't know your dad was a dentist. So
yeah, both my parents were dentists.
Yeah. Okay.
So yeah, my dad actually is still practicing, and it was his 40-year anniversary at the practice this year.
That's what I like to hear, because a lot of people go to me, "You're 57. When are you going to retire?" It's like, why would I retire?
Yeah.
I love what I do. I'm still good at what I'm doing. I haven't got the shakes, so it's like, why not?
I can still see.
Yeah, just about see. And I'm still enjoying it. And I think that's the big thing. It's like, if you're still enjoying the journey and you can give and you can give back, which is the biggest thing I love, then why not carry on doing it? It's brilliant. So
Absolutely.
there'll be a period if I wake up and go, God, I don't want to go into practice today. That's when I'm going to stop and say, you know what, it's time to stop. But at the moment, I love it. I probably don't love it as much as it was last year. It's been an interesting journey in the last year, and we'll talk about that. I forgot how hard it was setting up a squat.
Yeah,
I mean, forget those things, don't you?
Yeah,
wipe the memory of.
That's it. So yeah, I mean, let's start with Bolane then. We'll go in reasonable chronological order,
Okay,
but
I'll do my best.
Was Bolane a squat? I can't remember
Yes,
the story
squat.
of how it started.
So actually, Bolane was an architect office beforehand, and it was completely empty. And I was trying to find what I wanted. So I was working at the Eastman, and I love the city crowd because they get it. They want everything done yesterday. They didn't care about the cost. It was like, just fix this tooth now because I've got to get out of here in half an hour. And it was brilliant because I could just do the right sort of dentistry. It was like, I wasn't negotiating all this and that. So I thought, okay, these are the people I want to work with because they make decisions. And I love the city. And the city was this was in 1999, 2000. The city was still very suits, very traditional. Dentistry was all everything was above the sort of shop front. There was no branding in dentistry. The only branding was a tooth. So you walk past, you knew there was a dentist there. Yeah. And everything was blue and green. That was it. And when you go to ADEC, what chair would you like, blue or green? There was no other. Sage green was the most popular colour for ADEC. So I was like looking for premises. I knew I wanted to have my own entranceway. I knew I wanted to have a lab on site because I'd worked at the Eastman. And I'd done all my own crown and bridge work. And after seeing how the detail is, not right, I need a lab on site. I need this much space. I want to have space for expansion. So I hired a property search guy, and his name was Richard Holford, and he was looking for me to try and find the right site in the city. And it took about a year to find something, and then he found it. And he put it in as a sort of sealed bid. They didn't know who it was and everything else. And I realised afterwards that I won the bid by £1,000.
Wow.
And it was another dentist who had gone for it.
Oh, really?
And they didn't know who it was. And I got this site, and it was just amazing. And it was like, okay, what we're going to do. Purple was my favourite colour, as you can see. And I was like, right, we're going to have purple chairs. And ADEC said, we don't do a purple chair. So was there a way you could do it?
Yeah.
And it's like, oh, well, we've got this final stuff. And in the end, they did I was the first purple chair in the UK.
Really? And
then we ended up having 8 purple chairs, and it was part of our branding and realizing that actually was so different. And there was no tooth anywhere. Okay, the logo initially was a sort of line drawing of the entranceway.
I remember,
so it was very different. And then we sort of changed it over the years, and I was there for 24 years. So, and the wonderful thing was actually going through and following the patient's journey all around, because I signed a long lease. I wanted to be there for them, and when they got married, and when they had kids, and when they had their mistresses coming around, and all of that thing, I was there for all their dentistry. And it was great to follow that journey and be there. And that was one of the big things that we had, was that we were very different, and we had different conversations.
And where did you get this branding spirit from? Is that something that you've always had?
I've always had it, and read, like you, I love all these different personal development books and reading all these different things, like Purple Cow. Seth Godin was one of my favorites. It was like, I was reading
great name for you as well.
Yes. It was great, all the books, and it was just like, this is so different. And at that time I was into coaching and development and thinking, well, why do I have to follow other dentists and what else is happening in dentistry? Because we are stuck in the past, and we were stuck in the past. We're getting further forward now. It's like, okay, what are they doing in the gym space? What are they doing in the spa space? Why does it have to smell of bleach when you go into dental practice? Why is that? Why do you have to stare at the ceiling and just get bored? Why not put a TV up there? Why not have sort of headphones and video glasses and stuff like that? Why make it completely, look at all the different senses? So it was like, okay, let's look at this. And when I was setting up the website, it was purposely, I wanted somebody who'd never done a dentist before. I wanted a website designer that'd never done dentistry before. I didn't want somebody with the same sort of cookie fit. And I wanted something a bit different. I wanted people to come in and go, wow, this is very different. We still do teeth, but I wanted the long-term relationship. So I wanted people who could communicate well, who weren't in it for just the money. It's like, I want to fit as many veneers as possible and get out. We want the long-term relationship. And that's the thing we did. And that was so great. My first hygienist with me, Christine, was with me for 20 years. So it's like, wow, all the people, I want people to stay for a long time and grow and develop. And then my first nurse then went off and became a hygienist, then came back as a therapist, and they come back to work with us. And it's all about giving back and getting the whole sort of remit and not trying to hold on people.
Well, I think Zacky's still there, isn't he?
He's still there.
You left a few behind, I think.
Not all of them. There's some that have come across, but yeah. And I think that was the thing, is like, I love learning and developing. I like going on courses. I like sort of getting my brain working, and I want the rest of the team to do it. And when they're talking about it, they're so passionate about it. The hygienists going, I went to this course, I went to this, and they're talking to their patients, and the patients go, wow, this person really wants to be here. They want to grow and develop. And I think that's the great thing. And then the brilliant bit was when they ever go to another dentist, it's such an anticlimax. And they go, James, I've got to come back. Please let me back in. Yeah. I really hate the fact that they don't talk to me. They don't do this. And that was the thing I loved doing, and innovating and changing the way people think about dentistry and dental care.
Love it. And how many clinical days did you do when you were there? I'm sure it varied over the years.
Yeah.
But
at the beginning, like 7.
It sounds like you put a lot of... you've obviously got a lot of headspace going towards the experience. Yeah. That takes time as well, right? So how did you balance that?
For me, the sweet spot was 3 clinical days. Then we had treatment coordinators and all that, but I had time, a day a week to sort of work on the business, another day on the week to work on sort of treatment planning, things like that, and then to do other stuff that I really enjoyed out of dentistry. So a lot of fitness stuff like you, really enjoyed the challenges and doing something different. I'm not somebody who can just go to the gym and lift weights and just to look good. It's like, okay, I want to have a challenge. I want to run the marathon. I want to do this. There's always something to try and strive. And I think that's the same in dentistry. It's like, okay, we do it this way, but why do we do it this way? And one of the things we loved at Bolane, because it was so different, we got so many people coming in. There were students who were thinking about doing dentistry, 6th formers. There were people in dental school who were trying to work out what they wanted to do.
I think I came as a student.
Yes.
I think we came with Zachy, I think, when I was a student, saw the lab.
Yeah.
I don't know if were you in that day? I can't remember.
Probably not. I think I saw the name in the book. And
I'm going to go work on the business.
Yes, that's it. But the thing about it, people think, oh, you're giving back. But actually, we got so much out of it, because everyone who came had to do a report at the end and say what would they improve, what they enjoyed most, and what could they improve. And they were sitting there, and the patients loved it, because they thought, well, if they're being watched, there must be something they're doing right.
Yeah. And they're not watching bad dentistry,
yes.
Are they?
And also they were going, well, why do you do it that way? And you're thinking, why do I do it that way? Or why are you using that lip balm? And think, why didn't you use that? And we got so many ideas from people saying, that's great. And also we encourage other people, and we discourage the wrong type of people in dentistry. So some people were just forced by their parents, like, be a dentist. And they would come and spend time with that, and you could tell they weren't interested. They weren't having the engagement conversation with the patients. They weren't chatting to the nurses. They weren't buying gifts for the team. They were just sitting there, just ticking a box just to get into dental school. Like, I've been to Bolane, and this is my work experience. So I try and encourage the people who really want to do it, because I think it's an amazing career. Unfortunately, none of my 3 kids are looking like doing dentistry.
No.
2 are definitely not. Third one's nearly 12, so there's still a chance.
Yeah.
I think it's an amazing career. It's done a lot for me, and also it's so flexible. There's so much you can do with it. You can 100%. Really just fix, and just, if you want to just do dentures, or you can just be in general practice, or you can do implants, or you can do whole body health, or you can just run a chain of practices and not do any dentistry if you're into the business side. So I think it's such a flexible career, and also now we're connecting the mouth to the rest of the body, and people are realizing that actually we're not just failed doctors who couldn't get into medical school.
Yeah,
we're actually somebody that communicates a lot more, and we can do more than fix teeth. And I think that's really exciting. I think dentistry is a really exciting place at the moment, and it's really going forward. And I had a conversation with somebody last week, and they were just talking about holistic dentistry and biological dentistry and all these different connections. I said, this is just dentistry. And this is how it should be.
Just good dentistry,
In 5 years' time, this is how all dental practices are going to be doing it. We're going to have these conversations. We're not going to just be scaling teeth without knowing what your risk factors are. And I think that's really exciting, and seeing those changes is brilliant.
Absolutely. I mean, that was one of the questions I wanted to ask you was, do you now call yourself a biological dentist? Do you call yourself a holistic dentist? Obviously, these terms are very loaded.
Yes, they are.
And they have certain connotations around them. I find the holistic one particularly amusing because when you think about holistic, it's like a good thing.
Yes.
But then in our profession, a holistic dentist, certainly for me, traditionally has had a stigma around it, that it's sort of a hippie homeopathic execution that's like not science-based.
Yes.
So,
and I think that's the thing with holistic dentistry. Before, it was like somebody who takes out all your amalgams and puts rubbish composites in, or somebody who just like does bioresonance and says, well, okay, there's something going on with this, and it's not evidence-based. And I think globally there isn't a global standard. There isn't a certified training. I mean, I've done every sort of training course. I'm connected with all the different biological, holistic dentists, done everything. I'm working with Institute of Functional Medicine now. I've done AFMCP. I'm doing an Institute of Functional Dentistry course now, which is a 2-year course, which is really, really interesting. They're connecting functional medicine to dentistry. So there's a lot root cause stuff. But basically, at dental school, as you know, we were taught not a lot about nutrition and food. And it was all about don't eat sugar, don't eat carbs, and don't snack. And that's about it. And then caries is not reversible, and you just have to fill a hole. And when I did dentistry, it was all amalgam. And we were taught how to cut black cavities and cut into teeth, and that was it.
Yeah.
And there was nothing more. And I think that's what excited me to see, actually, I can reverse disease, I can reverse tooth decay, but I can reverse diabetes, I can reverse cognitive decline and Alzheimer's, and these things really exciting. And actually, it's not just about that. And I think the tricky bit with when you go into one camp, and I would say I'm a dentist who's interested in total body health. I've done holistic dentistry courses. I'm on holistic dentistry registered. There is in the States, there's the Institute of Oral Medicine and Oral Toxicology, IOMT, and they have accreditation. And I've done the accreditation with them. So I've done the Smart Amalgam removal protocol. So I know how to remove an amalgam as safely as possible.
And they're really only, when I was doing the research, it told me there was only five dentists
accredited in the UK, yeah.
Is that
yes?
So who's that? You?
It's me.
Carol?
Richard Pollock has done it as well. So he's done
Seb, I assume.
Seb has done not all of it, actually. He's only done half
interesting.
of it.
Oh, okay, interesting.
You can ask him about it.
Yeah, I will do. I'm having him on at some point.
You haven't finished the other half, then. Go on and pick it out.
Who else then?
I can't remember.
You're not sure?
I'll have to find it.
I thought there'd be loads of people that had done that.
No. There's a guy in Knightsbridge that's done it as well. So you go on their website, OMT, and you can look at certified accredited. And I think there's 42 of us that have done the Smart Amalgam protocol. And again, when you talk to conventional dentists about amalgam and mercury and things like that, they say it was totally safe. And well, okay, it's a poison. We know that. We know that it's a toxin in the environment. We know that you've got to be really careful if it goes into the water supply and there's problems. But apparently it's safe for us to drill out and have vapors in and breathing out all day, which I don't believe. So if I'm taking amalgams out now in the last 6 years, if I take them out, and I only take them out clinically needed. So that's the interesting bit, is that some of these holistic dentists, if somebody comes in and says, I want this amalgam out from my upper six, and they go, why would you like that? I think it's causing my rheumatoid arthritis. I said, well, can you prove that? Or is there any reason? And I said, well, let's look at it. And if clinically that amalgam is sound and there's no other symptoms or anything that's going on, I'll say, I'm not going to take it out. We'll take photos, we'll review it. If they're really adamant, we'll then do a thing called a tri-test, which is a hair, blood, and urine test to see actually levels of mercury in their system. And majority of patients, when I do that, methyl mercury is very low, so there's no leaching. So I say, well, actually, there's nothing I can see clinically wrong with that. The tests that show you haven't got any leaking of a mercury in your system, therefore I'm not going to take it out. Whereas some holistic dentists will just take them out. Yeah, because that's asking. And I want to be evidence-based. If I find there is leaching, then I'll take it out, but I'll take it out as safely as I can. So there's there's this level. If you look at biological dentists, they don't believe in root canals. So they basically said, if you have a dead tooth,
James. No, let's not get into too many too quickly.
Okay, fine.
I want to stick on the amalgam conversation for a second.
It's just interesting where if you look about holistic,
they actually have different beliefs almost. I didn't realize that.
That's the belief, and then there's the implant belief as well about the metals and things like that. So
is that a biological dentist thing versus a holistic dentist thing?
Yes. So when you're talking about that, it's tricky. So I'm actually not in any of those courts. If you look at the dentist, the holistic and the biological, I have a foot in all of them because I don't believe one is the right way.
Yeah.
And for me, it's all about the patient and the patient's journey and the story. So when they're sitting in front of me, what do I do? And I believe in fluoride works. Hydroxyapatite also works as well. And again, it's what is right for the patient. And for me, the best dentistry is no dentistry. So what I can do. But if I'm going to intervene, it's what is the most sort of holistic and the most conservative option I can do for them. What has got the most evidence, and then do they have a reason why I have to avoid a certain material? Are they allergic to something? Do they have a preference or something?
Yeah.
And then trying to work that into the history of what's most important, what's going to give them the biggest bang for their buck almost. What do I need? Because some of my patients come in and they go, I want to get this mercury filling out. I want to get this done. But actually, they've got quite aggressive gum disease. And I'm saying, actually, we need to fix this first. This is what we want to do. And trying to get them to think about that from a sort of total body.
That's interesting. Yeah, I obviously have a lot of cosmetic patients coming in asking for cosmetic work that have gum disease, and that's the Trojan horse.
Yes.
Your Trojan horse is actually the biological side of things.
And they've read the podcast, or they've seen sort of a YouTube video, or they've seen an Instagram reel about like titanium implants are causing problems. So I want them out, and they just focus on that, and they need to be heard. That's the first thing, and I think that's where some dentists go wrong. It's like dismissive completely, and no option. And I get patients coming to me all the time who've been told by their dentist they need a root canal, and they don't believe them. So they come to me and I go, well, how long have you been seeing X dentist for? And it's like 23 years. So you've been seeing them for 23 years. They've been doing regular care and all the rest. I've seen that. Yeah. Do you trust them? Yeah. But then they've told you need a root canal. Yeah. But you're coming to see me. Yeah. Because I don't believe I need a root canal. And actually 9 times out of 10, they do need a root canal. But what they're not is they're not being listened to, and they're not going through of, okay, why has it got to the stage that you've been going regularly that suddenly this tooth needs a root canal? Have they missed it? Are they watching the area and they're watching it? Or is there something changed in their lifestyle? And sometimes it's they're chronically stressed and they're clenching, grinding. The vitamin D is through the floor. And they've got all these other things that have then pushed this tooth over to needing a root canal. And actually, if you step back and say, well, actually, let's get you a splint. Let's look at this. Look at your diet. Let's look at the stress. Let's get some stress counseling. Can we do all these other things? You'd still need a root canal. We're going to do this for you. However, this will stop you having other ones. And I think that's what's missing in general dentistry. They're 100%. Just fixing the problem and not saying what's the root cause. Give the patient some control. Now, some of them don't care. They go, I don't really care. Just do the root canal.
Solve this problem. Yeah.
But a lot of patients really are interested and say, look, okay, I understand I might need this, but can you help me stop me having another one in the future? I think that's the interesting.
He's going that next step down, isn't it? I want to double click on the amalgam thing for a second, because I think I mean, from a purely selfish point of view, obviously I drill out a lot of amalgam.
Yeah.
And pop a little Xeric in there or something like that, or maybe a 3D printed restoration now. But tell us a bit more about the actual smart protocol then, because in my head, you're in a full gas mask, like you're in a full hazmat suit.
Yeah,
I don't know if that's true or not, but like what actually is involved?
If you think about COVID, it's similar to COVID protocols. The most important bit of it, the whole process, and where people go wrong, is rubber dam. And I'm sure you're putting rubber dam on everything, but a lot of people don't. And I think that helps the patient feel secure. It stops them swallowing loads of mercury and bits of mercury filling as well. And that is probably 80% of the protocol, is actually getting that in first, the rubber dam, and sealing it properly beforehand. So if you want to go to the nth degree, and we give our patients all the options, the first thing is take it out when they're as healthy as possible. So you don't want to take out filling when somebody's got a cold or a cough or not feeling well, because their immune system is slightly suppressed. So that's one thing that's quite important. When you drill it out, they're going to swallow bits. There's going to be vapors and things like that. We want to increase their sort of hydration. So we tell them all to have 3 to 4 litres of water that day. Try and flush it all out. And obviously some patients are more susceptible than others. So I've got loads of patients who are immune compromised. So if they're immune compromised, we really want to detox them as best as possible. So we do the rubber dam. First of all, we seal the rubber dam. We're really careful. Before we do the rubber dam, we use activated charcoal as a mouth rinse. So what we did, that coats the mucosa. Very cheap, nothing difficult. Just rinse around for 30 seconds and it coats the mucosa. That's the thing we do as part of the SMART protocol. Then we put the rubber dam on, we seal it properly. And then the difference
What do you mean by seal it?
So we seal it with flowable resin. So we just make sure that basically, and we invert it. We put ligature ties around, things like that. So we try and seal it as best we possibly can.
Just top class rubber dam, basically.
Yeah, basically. Yeah. So it's all simple things. Now, the next level up from that is that we actually use FFP2 masks. So we put better filtration masks. The patients have hair nets on, and they have a gown over the top of them. Okay. So they're not completely covered, but most of them are covered.
Yeah.
Then, because they're covered with all this, we give them a little cannula with oxygen. So it just gives them high flow, pure
nasal cannula
for oxygen. And then after that, we use a high volume suction. So we use a IQ Air thing. It's like a big tube thing.
Miguel's got the same one.
So just before we're about to take the amalgam out, we then get as close as possible for that. And that's safety for them and us. And then when we take it out, we're just careful to try and chunk it. So rather than drill around everything else, we want to go through the middle, cut it into 4, implode it on each other, take it out and try and take it out in lumps.
Right.
And that's it. So that's basically what we do that makes it different.
So no big hazmat suit.
No big hazmat
just
suit.
Just an FFP2 mask.
No, yes. And it's just trying to protect them. Some of it is they want to see that we're careful about it all, but it's to protect us as well. I've been doing this for 35 years. I don't want to have mercury poisoning and all that. So I'm careful when I take them out, but also careful with the patient when we're doing it and try and do it. And then obviously whatever I put in, I want to make sure it's going to seal properly and last as long as the metal filling. But we're doing it when it's clinical necessary. The difference is also that some patients, if they're immune compromised or they're really, really worried about it, we do have a whole detox program. So they have 2 weeks beforehand, and we don't charge for any of this. 2 weeks beforehand, they can then have high dose vitamin C, and then for 4 weeks afterwards, they're having chlorella as well to help flush out the system. So
was there like selenium or something tablets that you can take? Is that a thing?
You can, yeah. I mean, some people go to completely different levels, and I've seen some dentists use IV vitamin C and all that there. I'm not a big believer in IV infusions of any sort of vitamins and things like that. I'm not a big sort of IV nutrient person. For me, I'm about real food, and if I've got time to do it, I want to build the patient up beforehand to make sure they're as sort of healthy as possible, and make sure their diet is anti-inflammatory diet and they're not having loads of sugar and processed food. But the important bit, and that's what people always miss, is rubber dam. And if you can get the high volume suction, that does 90% of your job.
Yeah.
And the patients
everyone
feel
can
safer.
do rubber dam, right? I mean,
well, they can do it, but do they do it?
Do they do it?
Especially when no one's watching.
Yeah, indeed.
Most of the time they don't do it. And
if there's a good Instagram photo, then maybe.
Yes. And also they don't take their time cutting it out. They just drill it out as quickly as possible rather than trying to chunk it out and try and not have to drill as much, because it's the heat that causes a lot of the problems with vaporing it. And just being careful with the patient. And some of my patients, if they're quite megally compromised with like, when's the best time to do it? When are you the most healthy? Sometimes in their menstrual cycle, we say, okay, this is the best time to do it. And so we try and do it, because most of the time it's not urgent. It's like, okay, we want to do it. When are you going to be the worst? And I think they feel protected and listened to. So, and we don't charge any extra for it. It's the same price if you do a smart amalgam removal. Is what we charge for the restoration that we're doing.
Right.
And we've done it so much, it doesn't take me more than a couple of minutes longer than doing it normally, because we're doing rubber dam and the team around me.
Yeah, there's nothing majorly complicated.
And I think that's the thing. So we're not trying to scare people into saying, and we know mercury's been banned in the UK, we're not trying to scare people in, but there are better materials out there now, as you know. There's adhesive materials. This just fills a hole.
Yeah, for sure.
Nice.
They do last very well, though, don't they?
They do last. I actually still have one mercury.
Oh, do you? There you go. That's good.
It's very close to the pulp, so I haven't touched it. So even though I'm a holistic or biological dentist, I have got a mercury filling. So
that's good.
You know what?
Living on both sides of the line, I like that.
Yes.
Is there an increased incidence in any mercury-related illnesses in dentists? I don't know the answer to that.
I haven't seen the stats on it. When you look at, people do say that we had the Mad Hatter's disease of the hat makers and all that
Dentists
stuff.
are all mad.
Yes. Well, we know we're a bit crazy anyway. So I haven't seen any stats of that. So I can't comment on whether they are or not. But I know that if you see the stuff, when I used to do it 10, 20 years ago, when you're cutting these there's mercury everywhere. You see vapors all over the light, everywhere.
Yeah.
You're thinking, okay, and we're inhaling it. and we didn't really, or our masks didn't really filter it. So it's like, okay, well, FFP2 masks are so cheap nowadays.
Yeah.
Why would you not wear it for taking out metal?
Yeah.
And it's not just mercury, we do it for all metal removals. Because when
Right.
you're cutting a gold out, you're going to get as well. So.
You're going to be inhaling gold. Probably also not a good idea.
Yeah. So.
As a modern cosmetic dentist, I'm always looking for tools, techniques, and technologies that I can bring into my practice to have a meaningful impact on my patients' oral health. One area that I found frustrating to deal with up until now is early carious lesions. We've always had to monitor them, and inevitably in many patients it ends up with them needing a filling, and we've really not had a great tool to deal with this. That is until now. What we've recently implemented is Curodont Repair from Vivardis. It's a biomimetic peptide technology that can actually arrest or even reverse early areas of decay, meaning that patients don't need to have that filling that they really don't want. It's incredibly easy to apply and it's suitable for all age groups. So if you'd like to look at Vivardis as an option for minimally invasive care in your clinic, then go to www.professional.vivardis.com/contact point. That's professional.vivardis.com/contact point for 10% off your first case.
Interesting. Well, I want to take a step back into Optimal because obviously as an entrepreneur and someone who's like always looking for new things, I was walking down the street and I saw it before I knew it was yours.
Okay.
I think I was actually at like a parlor, like a pitch, like an investor meeting or something. What
was your first impression? That's what I want to know. It's like,
I thought, I was immediately attracted to it.
Okay.
Obviously, I love Optimal. Like optimization is like a great joy of mine in all walks of life. And I was just drawn to the focal points of it. Really, I hadn't seen somewhere that was so overtly focused on the mouth-body connection. And just aesthetically, I think it obviously looks great, as I'd expect from you.
Thank you.
But yeah, it was funny that I saw it, as I say, as something not linked with you, and then obviously latterly saw. I don't think you even opened them when I saw it. No. I think it was just being built. But what was the story there? What was the link from Bolane over to Optimal?
Yeah.
And how long have you been going for now?
So we've been going 18 months, and so. Basically, when Bolane, the lease was coming for the renewal, I was like, okay, what's going to go on with this? I'm going to renew the lease. So I was negotiating the landlords. And then I actually, as you'll have, as I'm sure, we get lots of corporates coming to want to buy us all the time. And every month there was another letter, another person coming to me. And I didn't want to sell. I was still enjoying it. And then with the lease was negotiating, I thought, well, what's the ideal lease? Because if I'm going to sign another 25 years, I may not be doing dentistry, and then I might be selling. I don't know what I'm going to do. So actually, one of the people kept pestering me, and I thought, you know what? I'm going to just bring them up and speak to them. So I had a chat, and I said, look, I'm not selling now. However, I would like, I'm going to renew my lease. What is the ideal lease? What are you looking for? What are the break clauses? What's really important in a lease and what isn't? So they gave me some really good tips and things on it. And they said, well, why don't you send your books to us and we can value it? And I thought, I don't want to sell. They said, well, wow. And I was like, then I chatted to my accountant about it, and he said, why don't you just get the valuation? At least you've got a benchmark and you know where to grow and you know what's working, what isn't. And then they offered me a really good price, more than I thought it was going to be. I thought, what am I going to do? I'm too young to give this up. What do I want to do with this? I thought, well, okay, I want to do something else. I was enjoying the dentistry. And at that stage, I'd just written the book, Kick Sugar. And I was realizing that there was a big connection between food, nutrition, and diet and inflammation. And thought, okay, how can I do this? So I started implementing it in the practice, but it was really hard when they had traditional dental patients who've not really talked about nutrition and everything. And I've been there for ages.
Yeah.
And suddenly,
why are you now bringing this up?
Why am I
after
suddenly?
20 years?
Why am I asking you about my sleep and my hydration and my stress? And so I thought, actually, would it be a good opportunity to do something completely fresh and something really different? And to all that. So that's when I started looking at, and then I've realized that I've never had a shop front before. It was always sort of above a floor. And I thought, okay. And I found this perfect location just outside my exclusion zone, which is 3 miles. It's in Baker Street, and thought, actually, this is great. What do I want to do? And I was really immersed in the nutrition world by then. So I was enjoying it. I was spending time with nutritionists, trying to chat and thinking, I need to know a bit more about nutrition. I don't know enough. And that's when I sort of reached out to different organizations, and then I signed up for a graduate diploma in functional nutrition with Institute of Optimal Nutrition in Richmond. And it was twinned with the University of Portsmouth, and it was like a 2-year part-time distance learning, and then you met up once a month and stuff. And I was really enjoying it. And I chatted to them, and they said, well, we've never had a dentist on this before. We've had one GP, but never a dentist. I said, well, let's do it. And realizing that actually it was so fascinating to learn in way more detail than we've ever learned about it. And I was learning about the vagal nerve stimulation. I was learning about sleep and all that. And that was
You were learning about vagal nerve stimulation on a nutrition course.
Yes, we were learning all about that. So it's functional nutrition. It's all about root causes and actually how we can get our patients to rest and repair and get the parasympathetic nervous system in and all that.
Oh, really?
So it was fascinating because I thought it was just about, okay, you're going to learn about proteins, macronutrients, micronutrients and all that. But it's like we learn, because it was all based with Institute of Functional Nutrition. So it was actually looking at timelines. So understanding somebody's, where their histories come from, when this started, when did this brain fog start, and why. Just
take a quick tangent on vagal nerve stimulation.
Yes.
Have you used any of the vagal nerve stimulators?
I've tried them, but I was disappointed.
I was disappointed as well. Did you buy the one off Health?
Yes.
Yeah.
I've bought so much rubbish that's still in the drawer and stuff.
I bought the same thing, and I think I hope my wife doesn't listen to this because it cost me like 300 quid. But I literally used it once and I've not used it again. I was like, because I was reading such amazing stuff about vagal nerve stimulation. I mean, some of the research on proper vagus nerve stimulation, I was listening to Tim Ferriss talking about it with a specialist, and it's amazing the impact that they're having with it, right?
But if you look at that, that's the thing, you're in the biohackers world and all this health optimization world, 60% of it is marketing and fluff.
Yeah, it's like, this is a real thing. Here's a product that says it's going to do that, but actually doesn't work.
And we've got no sort of evidence on it and no double-blind stars. And I think the interesting about a nutrition course is it all goes down to basics. Our body wants to heal itself. If we take away enough of the stimulus, it will heal itself. And I think that's one thing I'm doing. And I'm as a detective trying to find out what is triggering that patient to cause those symptoms and pulling things away from them. So it might be stress is a big trigger, and what can we do to reduce stress? It might be sleep, and dentists really don't talk about sleep. They really should be talking about. They never say that sleep apnea is a huge thing, and we can fix it, but we need to be chatting. And most of our patients only go to see the doctor or the GP when they got a problem. They see their dentist, their hygienist all the time, and they have these conversations. It's like, how do you feel in the morning? It's like, okay. And then,
I mean, sleep disorder breathing in kids is Megan's big passion topic, because it's a hugely underdiagnosed problem.
Massive. And also early interceptive orthodontics and all that. And it was like, I'm from the tradition where everyone had 4 teeth out and fixed braces, and everyone had the same narrow arches, and then I've got positional sleep apnea because I've got no space for my tongue, because they just took the teeth out and moved everything back. And nowadays, okay, what can you do? And I'm sure you've read all Weston Price's work and all that. It was actually best orthodontics treatment is your tongue and chew your food. Yeah. Which we're not doing. Yeah. And I think a lot of this stuff it sounds like it's all new age, but it's sleep, it's hydration, it's movement, and it's stress reduction, and then it's food. Yeah. That is it. If you can get back to that, you don't need any woo-woo, but everyone wants a quick fix. Everyone wants something like, I want to get this gadget so I can still eat the crap. Yeah. I don't want that.
Yeah, give me the vagal nerve stimulation as I have my McDonald's.
Yeah. And it's like, wow. And then people come in and go, I want IV nutrition. I'm like, why don't you just don't drink alcohol? Yeah. You're having the toxics and you want to retoxin. So I think that's the interesting stuff that we have at the moment in dentistry. We have these conversations and we start that. And putting simple things on the newsletter or your medical history is like, how do you feel in the morning? What supplements do you take, or what toothpaste do you take? You find out so much about somebody by asking what toothpaste. And as a parlor toothbrush manufacturer, first question you ask what you take, because you know if somebody's going to have the tabs, they're really interested in the environment, they're interested in the ingredients, they're interested in not having crap in them. Yeah. Because if they say, I have whatever my wife buys, then you know that
whatever the cheapest Colgate is on the
and you're having a different conversation. And I think I'm trying to build rapport with my patients pretty quickly, especially the new ones at Optimal. And it's like, how can I build a rapport quickly enough? And how can I find out what they're interested in? Are they wearing an Oura ring? I know they're interested in metrics, so I'm going to give them loads of metrics about their oral health. Whereas some of them are not interested in that. They're not wearing that. They're not interested. They just want me to fix a tooth. But it's looking at those different filtrations and what we can do. But I think as dentists, we need to all be asking about sleep. We all need to be asking about movement, exercise, and stress. We need to be asking about food.
Well, let's dive into those each in detail, because I think it's really interesting. especially on the food side of things. So as you rightly say, obviously everyone's asking about sugar.
Yeah.
Obviously everyone's asking about fizzy drinks.
Yeah.
All the obvious stuff. Let's park that.
They do, but they don't have anything to go with it. They just, once they've done the sugar, don't eat the drinks. That's it. There's no accountability. There's no coach. It's like, I'll see you in 6 months' time and we'll be checking on that tooth to make sure you haven't got a cavity. Okay, what's happening in that 6 months' time? We know everyone's going to do great for maybe 4 to 6 weeks. They might be changing their diet slightly. Then they have a stressful day at work or something happens, or they go past Marks and Spencer's and see some food they like, and suddenly they're back into the old habits again. And then they panic a week before they come and see us again, and they go, "Oh, I'm going to floss like mad. I'm going to do this," and they expect it's going to be all good again. And I think that's where we need more help. It's either we need more help on coaching, behavioral change, or we need to have a toolkit to say, "Okay, Simon, we found this cavity here. This is our caries prevention program. Here's the leaflet. This is what we're going to do. This is a health coach that can check in with you. We're going to send you WhatsApp messages every 6 weeks to check on it. This is, if you're interested in nutrition, this is what we can do, and this is a resource for you." And helping people to go through it, because most of them want to do it, and they know what's good for them, and they know how they feel, but they haven't got the resources. Do you offer continuous glucose monitors to them and say, "Look, try this for 2 weeks. We'll get some data, and then we can have a conversation." And they feel listened to and nurtured, and then we can help.
So is that your protocol?
Yeah.
So a patient comes in, they've got a couple of areas of decay.
Yeah.
And then they go on to a caries prevention program.
Yeah, and we look at Curodont or something to regenerate things. We are really strict on them coming back, going to the hygienist. We go through diet sheets and histories, and we want it back. It's not like, here's a sheet. See you in 6 months.
See you in 6 months, yeah.
But we have a nutritionist on board. We're just having a functional medicine doctor starting with us next month to try and help with that. And for us, it's all about accountability and having somebody to help. All the best athletes have a coach. If we're expecting our patients to make behavioral change, we need to help them with that journey. And
so is it the nutritionist that's WhatsApping them and
yes.
contacting them?
Yeah. And then we've got the team, a TCO, following it up. And again, we've only been doing this for 18 months in this clinic, and we're working out what works, what doesn't work, how we can make it profitable. Because initially we're just doing it everyone for nothing, and it's like, okay, this is taking a lot of time.
Yeah.
And how can we get a good case study of before and after and what's working, how we can motivate our patients. And one of the simplest way we found to motivate them is having a phase contrast microscope, a huge screen up in the hygiene room. And then when they come in for the hygienist, we take a swab from the deepest pocket, put it up and show them what is actually happening in their microbiome live when they're in the chair. And
Wow.
most of them go, they cannot believe what's in the mouth because no one showed it to them before. It's live. We haven't changed anything. It's done in 30 seconds. And they go, wow, I can't believe that's my mouth. I can't believe my husband kisses that. Like, okay, we need to see about it. And then they go through the hygiene program. We get them back in 6 weeks, do another swab, and we compare them and we send them the videos and you can see what's going on. And that motivates them to change. I think it's what can we do to motivate our patients. We need to get more metrics in dentistry. Can we get baselines in something, caries control, bleeding scores, plaque index, but can we then follow them up and do that? And I think that's where we're working more and more on. I think I'd like to have more follow-ups, and we're working on how we can do a plan where somebody pays a monthly fee and they get that in, because we know dentistry is expensive. So if we can try and say, well, okay, to do this restoration is probably going to cost £200 or whatever. However, the prevention is free. So let's try and work on it and get you back in. So I failed if they come back in 6 months' time and they've got another cavity.
Yeah, absolutely. And so how's it working? I've got a good friend who's a nutritionist. I've been every time we're out, we go on holiday together every year. Every year I speak to her about coming in and get her in the practice. Yeah. How does that relationship work? Is it just an associate? Is it on a percentage split?
Yeah. So it's a percentage split. We've looked at different ways of doing it. And interestingly, initially people don't want to pay for nutrition advice. I don't know what your friend thinks, because everyone thinks they can get it from ChatGPT or some sort of AI tool. So they put in their diet, they put in their blood things, and they go, well, actually there's more nuances than that. And it's accountability and following them up. So we found the best way that's worked is doing it all remotely now. Right. It just got too expensive having face-to-face nutrition. So we get people to do all their forms beforehand. They've got the data and timelines and stuff like that. And then they do consultations online. And we try to package them in. So we've got one that's an implant optimizer, because we know that people are spending a lot of money having a dental implant and they don't want it to fail. So what is the best way? So we do their vitamin D beforehand.
Yeah, so
we look at HbA1c, seeing where they are now, but then how can we optimize it? And then can we give them a guarantee? So if they do this program, they get a guarantee for 5 years for their implants to integrate as well. And how can we make it easy for them to go ahead with it? So
that's a post-placement optimization
before
pre-placement optimization.
Everything's pre because we want to get them in the right state before.
So how long does that take?
It's a 6-week program.
6 weeks.
Yeah. So and we're trying to tweak it. We haven't got all the answers. Not all of it's working. Sometimes we change it and I tell my team, this is the latest puzzle we're solving.
Yeah.
This is what we're testing. And in 2 months' time, it might be slightly different because we're trying to work, but patients are getting really interested in it, and they want to have some sort of control over their treatment and how it works. But I'm trying to make it work for dentistry and also profitable, and that's the tricky bit, trying to get to that. And I find nutrition is the hardest. I'm hoping that GP and medical is easier because people are more interested in that, and they're more interested in their health as well. And it's harder to get that online by AI tools. And I think...
Sorry, go on.
No, I was just saying that about healthcare, it's very bespoke to them. We want it to not like everyone's coming back in 6 months. And I think that's where some hygienists and therapists go wrong, is like, I want to see you again in 6 months. And they don't give enough of a reason why to come back in 6 months. And the patient hears 6, go, well, they said 6, it's probably 8. And by the time they book, it's 9. And they come back and then I'm going to get told off for not flossing again. And that's it. But actually, if it was like, you're going to measure my vitamin D, you're going to measure my CRP, you're going to show me the bugs on the screen, and I'm going to have a cheaper dental bill, and this is what we're doing. And then when they come back, they talk about the different things as well in more detail and make it more bespoke to them and say, actually, you've done really well, Simon. Your bleeding score has gone down from 38% to 12%. Look at the slide now. So now, actually, instead of 6 months, we're going to see you in 9 months because you've done such a good job, and giving them a reason. But remember, there's this one tooth that we're worried about. Give them a reason to come back. I think that's the thing, and obviously have a great experience while they're there.
Interesting. And I mean, on the diet side of things, you've obviously done a lot of work into it yourself.
Yeah.
Things like vitamin D, vitamin K2, the diet's impact on the salivary profile and the protective nature of that.
Yeah.
Can you give us a bit of your thoughts on that? Because that's something I'm really interested in. I admittedly don't know a vast amount, or not as much about it as I feel like I should do, really.
I think so vitamin D is actually a hormone. It's the master hormone. It helps the immune system work. As we know, it helps the bones develop. It helps growth. And actually, more and more studies have shown that you get more caries if you've got low vitamin D. Probably 80% of the UK are deficient in vitamin D.
Almost every patient I test is deficient.
And I mean, I supplement the whole year round. I double it up at winter time.
Unfortunately, I'm too high on mine. I had my bloods done recently, and I was at like 250.
Oh, wow.
Doctor was like, maybe rein it in a little bit.
Yeah. What are you taking at the moment? What were you taking?
I used the Bare Biology
drops.
The spray. D3 with K2, yeah.
And you peppermint or non-flavored?
It's peppermint, I think. Yeah,
okay,
it's on top of my coffee machine out there.
So they do an unflavored version as well.
Oh, do they?
Which is quite good. No, I like Bare Biology. It's a UK company. It's not
great.
got rubbish
I use their omega 3 as well.
Yeah.
It's great omega 3.
There are loads of different supplement companies out there, and loads of patients ask me about things. But for me, vitamin D, and there's so much evidence on perio. So perio and how well inflammation, vitamin D, caries control, and it originally started at implant failure. The number one was implant, and especially if you're spending all this money on implants.
Yeah, but we test every patient that has an implant.
And I think really every dental patient really should have their vitamin D test, because it then opens up a conversation about diet and nutrition and stuff, and realizing what they're taking, what they're not taking. And most people can't get enough in the sun in the UK, and definitely not in food sources. I mean, it's in butter and certain sardines and things like that, but you can't really get it in food. So that's the one thing that we need to have.
I think patients with darker skin complexions need it, are more likely to need supplementation, right?
Yeah. And also, not everyone absorbs it. So you might supplement, but actually it makes no difference. So we'd test, and then we would suggest a routine depending on their level. And then we retest in 3 months' time and see, are they absorbing it? Is it too much? Is it not? Some patients don't absorb it. They've got a genetic SNP. Yeah. And we end up having to do IM vitamin D, especially if they're doing implants or something like that, when they're spending money or they're having multiple teeth out. And we've noticed sort of haven't done a study on it, but I've noticed that ones we've been testing and then we take teeth out, they're more likely to have dry sockets. They don't heal as well after any surgery as well. So for us, it's a simple thing to say, look, I want you to heal quickly. I want the treatment to go well. Just take this for 6 weeks and then we'll do the treatment. And I think starting to look at that a lot more, and it's a really simple thing. And you go to, interesting bit is everywhere you can buy it now, Boots and things like that. There's a company called Nutrition Geeks that's actually really good, that they've actually dropped the price. So you can get a year's worth of vitamin D and K2 for like it's 20 quid. So it's actually, they're tiny little tablets. So there are loads, on Amazon they sell it as well. So you can get it anywhere. And I think all dental care professionals should be testing. But if you go back one step, and you're great at this, but most of the dental care professionals are not, of self-care and doing yourself first. It's like, test yourself first. You know your level. But it's like, you can't have a conversation with a patient if you haven't tested your own vitamin D.
Yeah, indeed.
So I think you need to test the whole team. And nowadays there's point of care machines now, cost like £20 a test or something, get results in 50 minutes. I don't know, which machine, do you have one of those?
I have the Apheus Body Tech, I think it is, which is VitD and HB1AC as well.
So there are loads of these point of care tests, and it's great because you can do it at the beginning of the appointment and have the result at the end. You can have the conversation on the treatment as well. But do you and your team first. And I think also look at diet, nutrition, sleep, and stress with your team, because there's no point you're sitting there. And I have conversations at the beginning of Optimal. I was just chatting about diet and sleep and stress. And virtually every time when I was working with a nurse for the first time they hadn't worked with me before, when the patient left, they go, it's really interesting. And can you help me with this? And they give me their vitamin supplements, or they give me this, and they go, no one's talked about sleep, and I'm stressed, and I'm clenching, and da-da-da-da. And they start putting the dots together, and they realize also that there's more to dentistry than just teeth. And it brings loyalty to the team members. So if you have a turnaround of nurses all the time, and you actually I want to get a nurse, because they're going to learn stuff, and they learn stuff with you, but it's not just they're going to learn about implants, they're going to learn about this, they're actually going to learn about health, about sleep. They're going to have better quality of life. They're going to deal with stress better, because dentistry can be quite stressful. We're trying to deal with lots of patients' anxiety and pain and things like that. It's like, how can our team work on this better? So when I'm telling my patients about Calmat or meditation or things that they can do, and acupuncture, it's my team does that as well. And we're starting putting more homeopathy into our treatment as well, because patients are really interested in that. We try, and like lip balm, we use sort of propolis lip balm, because some patients are allergic to, they don't like Vaseline, they don't like petroleum jelly, they don't like mint. There's people that don't like mint. So now we have about 15 different toothpastes. So if somebody says, I don't like mint, yes, and tabs and all the rest of it. I love your purple parlour.
I thought you might like the purple one.
It's my favourite. So, but it's just having that conversation, and I get patients come to see me and they go, why have you moved from your dentist? Well, they won't tell me what's in their materials. Or I ask the hygienist about what's in the paste.
That's why.
They don't know. It's like, why were you? We all did material science at uni. We should really know what's in our products. And interesting, one of our really popular blog is, what local anesthetic can I have? And we have all the different, and some people just really don't want adrenaline, and they want adrenaline-free anesthetic, and they want to know about that. And there's lots of woo-woo stuff out there about graphite dioxide in local anesthetic things.
Okay, I've not heard that one.
There's all these different additives, and people say you're injecting me with these chemicals, and it's all, a lot of the people from anti-vaxxers and don't want to have this, but actually being really honest to say that this is our menu of local anesthetic.
Ingredient transparency,
I'm going to choose what I think is best for you. But if you think patients come and say, I'm allergic to adrenaline. We know they're not adrenaline, but they've had a really bad ID block and had an issue afterwards. But giving them that simple control of like, this is the local anesthetic we can use, and this is why we're going to use it, and giving that. And I think that was a bit more transparency, a bit more openness, giving 100%. A bit of a choice of doing it. And then I think that makes it a more interesting journey.
Well, I think transparency is vital, right? I mean, that's literally one of the reasons why we created Parlour, was I wasn't comfortable with the ingredients that were in main mass market toothpaste. And it wasn't hard just to go through and be like, right, do you need this? Do you need that? Do you need this? Do you need that? And keep all the actives that are necessary for disease prevention, and then remove the sulfates and the PEGs and the titanium dioxide and the SLS, artificial colorants and obviously SLS. And it is a no-brainer, really. But people just don't know about it in the majority, even in the profession.
Yeah, I was just trying to educate people about it. And this is the thing I get in big trouble for, because when people ask about toothpaste, I would say, you don't need toothpaste, which is not great for parlour, but you don't. I mean, we're not deficient of fluoride.
You don't if your diet is immaculate, yes. Which is no one.
Well, actually, most people have toothpaste for stain removal. And I think that's most people. I mean, my diet's pretty good. It's not immaculate. It's pretty good. But I drink coffee. So I'm going to get stained teeth. So unless I'm putting something in my toothpaste or bicarbonate soda or something, if I'm just brushing with water, I'm going to have brown teeth by the end of it. So I think people want a good looking smile. They want fresh breath. So it's like, okay, what do we need in the toothpaste that will help
to achieve that?
Yeah. I mean, I've got a patient who has got immaculate diet. He's just worried about bad breath. So he just chews mint leaves. That's it. In the morning, if he's going to a meeting or something, he chews a couple of mint leaves. That freshens his breath, and that's it. He doesn't want to have any toothpaste. Doesn't want to have anything. It's like, fine, okay, I'm going to have that conversation with him, and I'm happy with that because his diet is immaculate, and he comes to see me regularly. But a lot of dentists will go, woo, 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 I'm not treating you. You don't believe in toothpaste, or you won't have the Colgate, and that's quite interesting.
Well, I mean, it's painting everyone with a very broad brush, I think. And unfortunately, the way we're taught is the public health message. And what I mean by that is public dental health, as in what works for the most amount of people with the simplest message for the least amount of money. Exactly.
Which is Florida, everybody.
Exactly. Because, and we know, obviously, that we need to sort the food system out.
Yeah.
Because nobody's checking what's going into these foods. Yeah. Cancer rates are going through the roof. Yeah. And we're meant to be medically advancing and improving our health status. Yeah. So
our health
what's going wrong?
Worse and worse.
So that's actually where it needs to be sorted. Yeah. But unfortunately, those companies that own the large majority of these big food brands are...
Well, it's big food, big pharma, and then obviously their marketing
and
budget.
Big toothpaste.
Yeah. You got that in there nicely.
Yeah.
It's just, we can't compete with them. But the interesting thing is they'll listen to your podcast or they'll see your Instagram reel and believe you and do that. They won't believe a big toothpaste manufacturer's reel.
Yeah. And
I think that's it. And people want a bit more sort of control of their own health and their health span and their journey. And interestingly, they will spend... yesterday I had 3 unemployed people come in. I was like talking about, because I always want to know what they do and all the rest of it. And they were paying me £250 for an hour consultation. They weren't working. They weren't only getting any money. I was like, why are you coming to me? I really believe there's something going on in my mouth that's causing whatever ailment they had. And it was really fascinating. They're prepared to spend that money to invest in their health. And that was fascinating to realize that people will, if the messaging is right and they feel connection with you and trust, and that you're going to provide some value of some sort and help their health, they're prepared to spend the money. And I think that's what people are not realizing. They will spend it. It's that they don't value it.
Yeah, value perception is the key. It's the same with toothpaste. Not want to drone on about parlour, but...
Here's your podcast. If you can't say parlour more than 4 times...
No, but I mean, our most expensive toothpaste is our best-selling toothpaste.
Oh, wow.
Which obviously in terms of price leading to volume doesn't make any sense, but it comes down to value perception as to what do they believe that this product is doing for them and how much is that worth. And so it's the same with dentistry. It comes down to how we communicate things.
Yeah. And it's also loving what you do. When people come in, they can see the passion that you love what you're doing. You want to be there. You want to help them, and they pick that up.
Yeah, for
rather
sure.
than it's like, oh, it's another checkup or it's another thing. It's like, okay, no, this is another person.
There's no value perception in a checkup and a
So that's
scale.
That's why we have a 15-point dental health check, and we go through all these things. And we look at Mount Patty scores, we look at breathing, we look at all these different things that people go, wow. We've just put in pH now, so we're taking the pH of our patient's saliva just to start that conversation. So we've got another metric to start on, and it's another thing. Actually, your pH is quite acidic. You snack, you have these things. This is another reason you're more likely to have sensitive teeth or more likely to have tooth decay. Let's have that conversation. It's just another thing to make us different and make them think this is something that I need to pay attention to, because they're going to be watching me and I'm not going to be able to get away with doing nothing.
Well, let's get back into that saliva chat then. So saliva test that you're doing currently.
So we do lots of things. So we do pH test at the moment. We do the oral microbiome, just the swab to look at what's going on.
Visualization under a microscope.
Under a microscope. That's with every hygiene patient. So we do that to motivate them.
Right.
And then the next stage up is saliva microbiome. So it's shotgun metagenomics. And we've been looking at that for the last 6 years. And interestingly, It's like, does it change the treatment plan? And that's always what I've been doing. It's like, okay, we know what's going in your mouth, Simon, but will it make the difference to my treatment plan?
Mm-hmm.
Initially, it was not really.
Mm-hmm.
I'm still going to do a deep scale. I'm still going to do this. It's not going to make a difference.
Yeah.
But now we're looking at antibodies and looking about your response to the host response to what is in your mouth. So we know now you've got a high level of P. gingivalis. How are you responding to that high level of P. gingivalis? And what can we do to reverse that and get the microbiome in balance? And I think for us is we want all the different bugs in our mouth, but we want a nice even keel of them. We don't want too much of one and the other. And the evidence of going, okay, Alzheimer's patients have got P. gingivalis in the brain.
Mm-hmm.
They shouldn't have it. It's an oral bacteria. It should only be in the mouth. So how has it go across? Has it gone across through into the blood? Is that through leaky gums? Is that because gum disease?
Mm-hmm.
Is it because they're swallowing it and their acid in their stomach is not acidic enough, so it's not damaging? It's going through into the sort of the colon, into the digestion and absorbing that way. Is it they're inhaling it in their lungs? How are they getting through? And we don't know at the moment, but we do know that we can fix the leaky gums.
Mm-hmm.
We can fix that. We can rebalance it, maybe probiotics for a course of people. Maybe it's a targeted antimicrobial for somebody. To looking at what is best. And it's still in infancy.
Mm-hmm.
So we probably do 2 or 3 a week. So we don't do a lot of shots on metagenomics because it's more expensive. But for our patients, some of them really want to know maybe they've got family history of Alzheimer's and they're worried about that. Maybe
Mm-hmm.
they've done the ApoE gene and they're worried about that. Mm-hmm. Can we help them? I had a guy yesterday who's really worried about halitosis and he's really worried about bad breath. And we've gone through his mouth and his mouth's pretty spotless. Restorations look pretty good. He's been to ENT, checked for a postnasal drip. So we're like, well, what's going on? Is it a GI thing? Is it H. pylori? Or is it some reflux, silent reflux? Or is it oral microbiome? So let's get the oral microbiome just to rule it out, see what's going on, if there's any sort of imbalances. And then if there isn't, it's like, you're right, you're going to go and see now GI people and have a look at that. So it's, where is our remit in that? Can we look at enough things to see? And I think eventually, and I think I put something on a LinkedIn post that you wrote something about, which is the toothpaste. I'd love to have a machine where you come into your dentist, you spit into a tube, it looks at the microbiome and says, okay, this is the parlor for you because of this microbiome, or you need to have this with hydroxyapatite because of the high risk of this, the pH of your saliva. And I think it'd be nice that we could do that in maybe 3 or 4 years to actually really make it bespoke, almost like Bionic does with the supplements.
With the supplements,
where they do your blood test and they go, okay, well, you're low on this and this. So rather than just taking a multi, it's like, this has got the zinc level for you. This has got the magnesium for you. And then we retest you in 6 months' time and see
how it's going.
And I think that's where the microbiome is going. And I think tests are still quite expensive. I think the lab bill is £220 or something. So it's
is it
still
Oralis that you're using?
Yeah, no, we use Oralis as well, and we also use Salient Bio.
Salient Bio.
Yeah, so they're the two. I've looked at Bristle. Interesting, when they first came out, there were 6 different ones, and I did all 6 on me on the same day, and I had 6 different results.
Oh, really?
Which
That's
is
fascinating.
panicking.
Yeah, that's not ideal.
Not ideal. But generally they're all healthy, which is good. But I think for us is the more testing they're doing, you can then compare the average microbiome to yours. So they've got a bit of a benchmark to have a look at it.
Yes, so you're comparing yourself against yourself.
So I think that works. And I think testing is going to get cheaper and cheaper. And I think it's not for everybody. It's not for every patient. It's like, why are you doing it? Are you worried about a systemic disease somewhere else? Are you worried about halitosis? Are you worried about caries risk? But again, it's then how aggressive our treatment is. So if somebody's got low vitamin D, they've got sort of 2 or 3 early lesions, they're snacking a bit, they're under a lot of stress, and they've got previous history of decay, I'm going to be on them way more. I'm going to be really going on them about diet and following them up more. I'm going to maybe using Curadent or something to try and remineralize. I'm going to be saying, okay, you need to have a hydroxyapatite toothpaste, or you're going to need a fluoride toothpaste or something. You're going to see the hygienist every month initially if the caries is all interdentally. We're really going to be on your pH. We're going to take xylitol gum or mints after snacking. We're going to be really focused on what you're going to do to compare to somebody else that hasn't got all those risk factors. And we might then do a microbiome test to look at their all their strep mutans and things like that and see, do we need to rebalance you somewhere? Do we need to suggest a month's worth of probiotics? I mean, because so many people have had antibiotics, which throws out the gut microbiome. We know that. It's got to be doing something to the mouth microbiome as well.
Yeah.
But then it's all about, and I'm sure Megan knows all about this, it's all about mouth breathing and what's happening at night.
Yeah.
Are they mouth breathing at night? Is that an issue? Is their saliva not able to rebalance their mouth? Could it be something as simple as mouth taping? So there are simple things that aren't expensive, but it's being a detective and looking at all the different possible causes. Why is your saliva not rebalancing something? What is missing?
So you're using the saliva testing not to change the treatment plan for the simple dental disease.
No,
so you've got perio. I'm not doing a saliva test isn't going to change your
not the initial
plan.
one, but what we've done it for when they've had the initial sort of deep root planing and all 4 quadrants. They've come back 6 weeks later and they've still got sites that are
so the non-responders basically.
The non-responders, like, okay, why aren't you responding? What's going on?
Yeah.
And that's then we're deeping in, but it's not a screening tool for every patient because it's expensive.
Yeah.
And also, will it change the treatment plan? You're still going to do the same thing. I think that's where dentists go wrong. They think, is it a magic bullet? Everyone's going to have this thing. We're going to bespoke it all. I don't think you need to do it. And I think that's the thing. And I think you look at levels of risk. So what you want to do. And again, the same with CRP and all the other blood markers is, some people want to come in and go, I want a Wellman test. I'm 40 now. I want all of it. I want to have a saliva microbiome
the
test.
me and you of the world, basically.
They want all of that stuff. I want to look at DEXA scan. I want to look at all these metrics. But for me, it's like, why are you here in the first place? What is the reason you've turned up? Is it because you've just broken a tooth and you just want it fixed? Is it because suddenly you are finding that you're lethargic, you've got brain fog, and you're worried about what the cause of the brain fog is? And then we look at all these different things and we find out that you've just recently moved, and that's what the timeline is. You've recently moved to a new place that's got mold, and you've had the amalgam fillings for years, you've had stress for years, you've had all these things, but the last sort of push on the lever is the mold, and that is then triggered your immune system, and then everything is going crazy. So like, okay, well, you can move again, but the likelihood is it's not going to reset on its own. We need something else. And that could be, we're helping with your sleep. That could be removing metals from the mouth. That could be looking at sleep and how we can do that. So that might be an overnight sleep test and saying what is happening with your sleep. It might be just telling them take their phone out of the bedroom, put an air filtration system in their bedroom. There's all these different things you can do, but it's like being a detective and saying, okay, what's going to give the biggest buck for you, and where can I make the biggest impact, and how can I collaborate with the wider community? Because we can't diagnose sleep apnea. I mean, we know we can see the signs, but we can't. So it's like, okay, well, I'm going to do an overnight sleep test. And when they thought I had overnight sleep test, I have to go in a hospital overnight and try and sleep. You try and sleep and then it doesn't work. And then the next time they say, well, we'll send a technician around, we'll put all the electrodes on. It was £900 for this overnight sleep test. Now I can buy a Watch Pack 1 for like 100 quid and I can sleep in my own bed and it connects to my smartphone. Gives great data. It's way more accurate than Oura Ring and a Whoop band. And then I upload it to the cloud. Sleep Consultants does it and does a report for them, which they can send to Boop or whatever, and then get their CPAP machine. So it's that sort of level that we can do, which is really fascinating. And I think that's what I want to try and get more dental care professionals to try. Look at themselves first and say, like, why am I so stressed? Why is this happening? How can I optimize? And then how can I do that to my team? And then how can I put this stuff into daily practice, but make it evidence-based, make it exciting, but don't do everyone the same. Not everyone's going to get a microbiome test. Not everyone's going to get CBCT. Have you got a CBCT machine? It's like, you don't CBCT every new patient.
No.
In the States, they do.
Oh, yeah.
And there's a big thing about cavitations. Like, if you had a wisdom tooth out, you must have a cavitation. The reason you've got chronic myalgia or whatever is because you've had a wisdom tooth out 20 years ago and there's a cavitation. And that's a bit of the woo-woo stuff that you hear in biological dentists. And people ring up and say, I had a lady in last month who said she's got a swollen left ankle. And the reason that ankle is swollen is because this tooth was taken out 20 years by a dentist who didn't do it properly, and she's got cavitation. It's like, okay. And she went to another dentist who said, I'm going to do cavitation surgery on you. And I looked at the x-ray and I couldn't see anything. And I said, I really don't think you've got cavitation. But okay, I said, if you think you've got cavitation, I want bloods to check. There's a thing called a Rantes test, which looks at sort of inflammatory markers for cavitation. We can look at a CBCT and have an idea. and I want a radiologist who's used to seeing CBCTs and used to looking at cavitations. And there's a couple in the world. There's a lady called Monica that we use, and she's brilliant. And she's like, I said, I'm very happy to do it. Blood test, we'll get the CBCT and the report, and if that shows, I'll do the surgery for. Well, I won't do the surgery. One of my team will do it. And she said, no, I don't want to do that. It's definitely my ankle. I'm going to get it done. And she went to another UK dentist who did the surgery without any of that stuff.
Oh, really?
And that is where biological dentistry is having a bad name, because in my opinion,
you got to do the diagnostics.
Do the diagnostics. You don't know if it's going to work. And then she's going to come back and say, well, my left ankle's fine, but now my right ankle's there. I think you should do this one. And I think that's the thing, is listening to them and saying, well, actually, the evidence is this. I need to know what's going on. I also want to know if my treatment's worked. So how do I know? That's obviously your symptoms, but if I've got baseline tests beforehand. And I think that's really interesting. And I think it's fascinating, that world.
Like many of you, aligner treatment is a big part of my day-to-day clinical workflow. And one of the latest bits of technology I've implemented in my clinic to optimize this orthodontic treatment is dental monitoring. Dental monitoring is revolutionizing orthodontic care by bringing patient appointments to their phones. Leveraging clinically proven cutting-edge AI technology, dental monitoring helps me hit the sweet spot between optimizing patient care and treatment time efficiency. You can monitor patient compliance, hygiene, and aligner progress remotely while maintaining regular and professional contact with patients throughout their journey. It really is a big USP. Far better care with far fewer appointments. So if you're interested in joining me and upgrading the aligner journey for your patients, visit dentalmonitoring.com/contact point to learn more and get a special discount off your starter kit. That's dentalmonitoring.com/contact point for your special discount. Back to the show.
Is there decent research in the linkage between cavitations and systemic inflammatory conditions?
Yes, there are more and more research on it, but because basically a cavitation is an area of dead bone. It's where the bone hasn't healed properly and there's local inflammation, and it's chronic. And we've had 4 or 5, I haven't done in 18 months. There's not a lot of cavitation treatments. When we've opened up to see it, you can see necrotic bone, you can smell it.
Really?
It's almost like a dry socket. We've all had dry sockets, unless you haven't done enough dentistry. Everyone's had a dry socket. So it's like that area, and it just hasn't healed.
Amazing.
And then you notice the CRP's up, your anti's up, something is triggering. But again, some people have these for years and years and years and never have an issue. And then something else has changed. Right. Maybe they've got more stress at work, or they're not sleeping as well, or something that their diet is not great, or they're on sort of HbA1c is off, they're pre-diabetic going to diabetic, and suddenly there's chronic sort of inflammation going on. So I think as dentists, we're brilliant at reducing inflammation. So if we can reduce that for people, and we can do it quite quickly, that will help the rest of the body fight it all.
You've mentioned stress a few times now.
Yes.
Obviously, as a profession, we're very, very stressed.
Not all of us are.
Well, I mean, if you look at the recent research from Dental Protection, I think it's sort of something like 75% of dentists report significant chronic stress as a symptom.
Yes. Might be when the Dental Protection renewal comes through.
Yeah, maybe. What's the linkage between stress and dental health?
Right. So there's obviously, we know stress impairs the immune system. We know when you're stressed, you're more likely to get coughs and colds and illness. And if somebody who's like been really working on a deadline, madly doing it, and as soon as you get the deadline and you get in, suddenly you just collapse and you're in bed for 3 days. And that's really common. So there's lots of evidence showing stress and inflammatory markers and do that. We know when people are stressed, they don't sleep as well. So again, they don't feel refreshed afterwards. There are papers of stress and oral halitosis that I've seen. There's also stress on inflammatory markers and periodontal disease. And there's obviously, we know that stress and TMJ and bruxism is a big thing as well. So it's like, we know stress is a driver on all of these different things. The pathway may be that the fact is their parasympathetic nervous system is not working as well. Their rest and digest is not working. Therefore, when they're stressed, when they're eating foods, they're more likely to eat rubbish. Their foods they're chewing not as quickly. And when they're eating stuff, their nutrients aren't being absorbed as well because it's going through the gut much quicker because things aren't working as well. So stress affects so many different things on there. And also we know that we're more likely to get tooth decay because you're snacking and things like that. So it's what we can do as dental professionals to reduce our stress in our working life. That is doing stuff that we enjoy. I think that's really important, having a way of de-stressing. So when I talk to patients about stress, you can pick that stress up from them. As they're telling you what's going on, you're getting more stressed for their day. And then you go, well, what do you do to de-stress? And you then say nothing. The majority of the time, I don't do anything. Or drink. Okay, how does that work for you? Not so good. And as they get older, they can't drink. So it's like, okay, what can you do? And it's something simple like setting an alarm on your phone every 45 minutes. You get up and walk around. They're at a desk. Can you go out in fresh air? Can you, first thing in the morning, get some morning sunlight? Can you take your shoes and socks off and grounding, things like that? Can you have an ice bath? Whatever works for you. It might be just having a phone call with your friends, going to the theatre. There's so simple things we can do to de-stress. And again, the good thing about these Whoop bands, Aura rings, things like that, they can tell you when your stress level is up. So it's just whatever works for you. And talking, most of the time it's just talking to other people and saying, you know what, I'm feeling stressed about this and whatever, and going through it. And I think in the holistic and functional medicine, wellness, biological dentistry, we get a lot of ill patients. We get patients that are they're at the last resort. They come to me, and you can feel the stress and anxiety on them. And if we can do something just to listen to them, that really does help and validate what they're saying as, okay, this is what I'm hearing. This is what we can do to help you. I think that really does help, and it makes it more satisfying. But I think for me personally, reading really helps reduce stress. I love exercise. I'm a grumpy sod if I haven't exercised for 3 days.
Yeah, same here. 3 days, one day, more like.
Is it? Okay. So I need to do the movement and exercise. And the other thing for me is I like to always move forward. I don't like redoing. I don't like redoing the same restoration I did last week.
Yeah.
I don't like telling the team member they've made something that is not quite right on the patient journey, and they do the same thing the following time. It's like, don't want to repeat saying that thing. So,
well, you value your time as our most precious asset, isn't it?
Time is important, but also I want to be learning and moving forward and learning and developing. So I think that's what helps me. But everyone's individual, and I think we had a really good team day where we closed the practice for the day, and everyone came together and chatted. And a lot of the time, the stress in a big team is about communication and the fact that not everyone's there on the same day, and just trying to get people on the same page with the patient journeys. I think that does help. But I think dentistry can be stressful because we're dealing with people in pain. We're dealing with money. We're obviously dealing with small businesses. There's lots of different people and lots of moving parts. HMRC, dental protection, more litigation, all those things can be stressful. But if you enjoy what you're doing and you talk to people and you've got friends to sort of share it with, I don't feel stressed in dentistry. I get stressed when my treatment doesn't go as well as I can. But then I say to somebody, like, I'm really sorry, Simon, we tried this didn't work. I'm going to try this now, or I'm going to refer you to a colleague. My colleague can help with this. And if I'm not sure, I just give them the money back and say, I'm really sorry, I tried this. I thought it would work. It didn't. Here's your money back. Let's go for plan B. And I think that's what a lot of younger dentists are not so good at. Not asking for help, not slowing down, thinking they can do everything, or thinking they can do all the Instagram stuff, all the sexy stuff.
Yeah.
All the white
without the foundations.
And they don't do the foundations. Or, I mean, I get more satisfaction out of somebody when they come back and go, you know what, those tips and that pillow you sent me a link to on Amazon, and the tips you told me to sleep, I'm sleeping so much better than I was 6 months ago. Thank you for that.
I mean, you can't say that and not give us the tips then. What are James's, what's his pillow?
There are for some people. So some people have posturepedic pillows that help with their neck and things.
Right.
Me, the 90 minutes before bed is the crucial, what you're doing before bed. You can't expect to go on a podcast, then do your emails, then do phone calls and all the rest of it, and then go on the bed, hit the bed and expect to fall asleep. There needs to be some sort of wind down. As we were kids, we used to have sort of a bedtime. We used to have a hot milk bath. We had a story. The lights went dim. We had a cuddle with our mums or dads, and then a story to us, and then slowly went to bed. And that was a sort of 90-minute process. But as adults, we're just always on it. And I think that's the thing we forget. And it's like, okay, let's be off all electronic devices 90 minutes before bed. Let's read a book. Let's have a relaxing story, whatever. Have a conversation. Maybe dim the lights, whether we have sort of lavender oil or something else, like have a bath or something, whatever works for you. And for me, the biggest game changer is a journal. I have a journal by my bed, paper and pen, and write things down before my bed, because I have a great idea. I was like, oh, I should be doing this tomorrow. And then your brain is thinking about all the different ways you can do it. But if you put it down there, it's like, I've captured it.
Yeah.
Tomorrow I can deal with it.
I've just started journaling again. I've had a tumultuous journey with journaling because I'm very aware of the benefits of moving stresses and thoughts from your limbic system, from your amygdala into your prefrontal cortex, making it more human and less chimpy.
Yeah.
And it's obviously something that's been around for thousands of years, right? Like, I mean, Marcus Aurelius' Meditations was just his journal. And so something that's lasted for that long has to be good for you. So I've tried the 5-minute journal. I've tried this. I've tried that. Actually, what's working really well for me at the moment, it's probably the longest I've managed to keep a journaling habit going. It's just writing down what I did that day and what I thought about it. Yeah. And I find that much easier than like 5-minute journals. Like, what are you grateful for today? Like what, like, and sometimes the structure
is quite hard.
It can be a bit like I'm just writing the same stuff every day.
Yeah.
I'm grateful for my family. I'm grateful for my health. It's like, but actually it's quite nice to think about what you did that day, because otherwise you just flash past it.
You forget all good stuff. Focus on the negative stuff.
Yeah, exactly. So
I went a period about 7 years ago when sleeping wasn't great and I had a bit of insomnia, and actually I had to do the journal every day and was writing things down. And then going back and reading it later was really fascinating. Like, I was worried about this, and why are you worried about that?
Yeah, that's very good.
So
that's the other thing I look forward to one day.
Yeah. You read down and see all the different things.
If I can read my handwriting, because at that time of night I'm just like
I've actually woken up at like 3:00 in the morning with an amazing idea, and I just scroll it down. I don't turn the light on to try not to wake my wife up. Scroll it down, and then in the morning I look and I'm like, what the hell is this? It's like there's an A and a B and a Z there. It's like, okay, what was that idea? But it's
we'll never know.
We never know. However, I got straight back to sleep afterwards. So the fact that
you got it out
there, I think that's. But most of the stuff is really simple. It's really free, and we just don't think about it. It's like breath work.
Yeah,
like that. We don't need, but people make it into a big thing, and like you've got to do 15 minutes meditation.
Got to have your 8-sleep mattress.
Yeah, you got all this. There's all these different things you got to have it. But actually, a lot of the stuff is really simple. If we keep that back to basics, I think that's really important.
Yeah, for sure.
But working on us first, our family, and our team, and then the patients, because I think then that works.
Yeah, it's good ethos. Do you find that you're obviously working at the extremities of what one would traditionally view to be dentistry?
Yeah.
Do you find yourself butting up against margins or barriers where you're on the edge of going too far into medicine or too far into something that's like outside of your remit? How does that work in your clinic?
When I first set up Optimal Dental Health, we set this up and we thought, okay, it's got to be food first, it's got to be nutrition. We wanted to make it look like that. And then some people say, is it an optician? What is it? What do you do? And then some of my regular patients who came to me for 25 years coming from Bolane, you still do teeth, James? I don't really want to talk about my diet. I want you to whiten my teeth.
Yeah. Aren't you a cosmetic dentist?
Don't we do the cosmetic stuff? Didn't you do BACD?
Yeah.
And it's like, okay, I've gone too far now. I've realized that. So we step back and it's like, this is dentistry, but we're looking at the whole body. But we'll go as deep as you want us to go. So some patients are not interested in this stuff, and we just do good, regular, good quality dentistry. But we're looking at how we can make it last the longest and have a bit more of an impactful conversation. So that's that. When I'm talking about sleep, I'm not a trained sleep specialist. I understand about, and because I had insomnia as well, I understand all the different quacks out there and all the different ways that they can upsell. I remember, funny, I can't tell you who it is because I'll get in trouble. But when I had my sleep apnea and went in and I saw one specialist, and they said, well, we need to send you to a specialist who makes these special devices. Okay. They didn't tell me what they were. They're special devices. That was it. That was like, they didn't. So I got to see it, and it was a dentist I saw. Okay.
Right.
So she went through all the history and went through all this. She was chatting about all that. So I'm going to make this special device called the mandibular advancement device.
Mm-hmm.
It's custom made. It's 3D printed. Wow, we're going to do a scan for the. And it's going to be £2,500. This was 5 years ago.
Yeah.
I said, okay. I said, it's quite a lot of money. What device? And she told me what it was, and I'm not going to say because I don't want to connect the dots. But,
yeah.
I said, you read a little bit about me, but you've missed one of the most important bits. I said, what's that? my profession. And it's like, she looked like, oh, you're a dentist. It's like, okay. And I said, the last time
that's
I made
£4,000.
Well, last time I made a mandibular advancement device, my lab bill was only £600. So it's quite a big profit you're making on that. I said, oh, I didn't realize you're in the profession. We can give you a discount on it. So she gave me half price on the discount.
Oh, there you go.
That was worth it. But it was just interesting. People don't look at that. And there's a lot of woo-woo stuff out there pulling the wool over patients' eyes. It's like, you're going to have this, you're going to have that. It's actually just having a conversation. I think that's, so I'm not a sleep specialist. I'm about to be a qualified nutritionist. I've got one more module to go and then I'll be qualified nutritionist. But I don't want to do nutrition. I love dentistry, but I love interweaving it all and understanding it. So I'm quite good at knowing where my limit is. And it's like, okay, that's as far as I know. And we're getting a lot of patients who are on various different medications who want to come off the medications. They want to do it and they're on Ozempic or whatever and they're losing weight. But they want to get off it in some way. So that's why I thought, well, let's get a medical GP in, somebody who's works in the NHS, who's got their feet on the ground, but is into lifestyle medicine, not into giving everyone prescriptions, not giving antibiotics and things like that. And I think that's what I'm trying to do, is get to the edge of where my knowledge is, but work with people who can help. So we've got a cranial osteopath who's in the clinic who helps with movement and helps with our ortho treatment. I've never done any ortho treatment at all in my career of dentistry, which is unusual. So we have somebody who does Invisalign, we have somebody who does expansion devices, we do myofunctional therapy now. We have a myofunctional therapist in it. So I know a little bit about it and I know how to screen for them. And I know, okay, these are the sort of patients or what's it. Same as that, I used to place implants. I don't do it anymore, but I know enough about it to say, okay, this could be a good immediate implant case. This is not a good immediate. So I know enough about that, but I'm always learning. I'm always developing. I don't want to prescribe people different things. I don't want to get in trouble with the GDC and take somebody off their diabetic medication. But however, I want to show to the GP, these are the markers. This is what we're worried about. This is what we'd like to change. And the patient's interested in doing this. Can you help us get off them? And some of them are interested, some aren't. Yeah. And I think it's just trying to find the connection with allied healthcare professionals who are interested in that, who are interested in the connection, and realizing that most of them are. I'm sure you've done it, but if you do a dental or an oral health talk to non-dentists, they are fascinated. They don't know about tongue scraping. They don't know about parlor. They don't know about SLS. They don't know about these things. And it's a great way of spreading the word of oral care. Whereas if you go to a dental convention, it's very different. It's tricky to spread the message. And I find that's really good. So I'm doing loads of health optimization summits. I'm doing longevity summits. I'm doing wellness things to make oral health more accessible. People to realize that they can reverse disease if they want to. And making it realize that, okay, one of the questions like, what toothpaste should I buy? How do I know? Yeah. You're on number 6 now. How many we allowed? It's just making it accessible and thinking actually dentistry is not that scary, and having the conversation. And if you can't have that conversation with your dentist about what is in that material, or okay, I understand this tooth is broken and it needs a cap or a crown, but I don't want to have another one. How did it break in the first place? What is going on? What's the root cause? Can you help me with that? And I think that's what we want to do as a profession more of. Is rather than doing that, and same with a hygienist, rather than just scaling every time and saying, oh, you need to use this, is that, okay, what can we do to help you to go on that journey a bit better and try and reverse this disease? And they don't want, most of the time it's bad, they come in for bad breath or they want white teeth. If you can actually show them, actually, this inflammation is causing problems systemically. Look, we do your CRP, it's really high or something. It's causing other problems. You've got a family history of GI disorders, or maybe you've got breast cancer in the family or something. You've got inflammation here. Your vitamin D is really low. You're at higher risk of these other diseases. You're only 30. How about we optimize this? Would you like to have a conversation? And they're really interested in it.
Yeah, I'm sure they are. Well, it's just that screening thing, isn't it? It's the same as for airway. We just got such a unique opportunity as healthcare providers to screen. I don't think there's anything wrong with that as long as you're making that onward referral where appropriate.
And it's the same with ENT. So I don't know enough about ENT. So if somebody's got halitosis or something else, actually it might be a postnasal drip or something else, or sleep apnea and I'm worried about something else, or maybe doing implants and you're worried about the sinuses, you're having that relationship with the ENT specialist who is interested in that, who won't give everyone just antibiotics for everything, but they're going to send you patients as well. So it's a cross referral, and it works really well. And I learn loads from them as well. So I think that's really fascinating. And then if we need to give antibiotics, and we do occasionally, we give probiotics with it. And it's like, this is the conversation. This is why we do it. We're trying to do the shortest course possible. We want you to finish the course, but we want you to have probiotics beforehand and be really careful. And I think they like that because it's like, hey, there's a little bit more thought to it rather than giving everyone the same thing and realizing that, okay, it might fix the problem, but it's going to screw up their guts. And can we do something about that as well?
What do you give? What probiotics do you give?
So we use a lot of Optibac. It's called for those on antibiotics. I really like it because it's just one tablet a day, so it's really simple. They don't have to take loads of different things, and it's got it's really good live formula and works for the patient. So that's what we use. There are loads of other oral probiotics that we can use once they're looking at saliva microbiome, and you can say, well, I want to use a lactobacillus one or whatever, depending on what is going on. Then that can be more
all probiotics microbiome.
So once you've had a look at all, but what I don't like is that people go onto health or something and just buy these probiotics. They've got no testing beforehand. They don't know if they need it, and they're just taking these things for the sake of it. Or there's a whole routine that you can take, and it's like, okay, well, that's not bespoke for you. We don't know what's going on in your specific case. Yeah. So rather than just giving everyone the same thing.
You mentioned there that you're obviously speaking at a lot of non-dental conferences.
Yeah.
Have you come up against resistance from the profession in terms of the progressiveness of your execution?
Yes. Yes. I mean, I get, whenever we're doing anything about talking about oral health and the connection between mouth health and that, some people think dentistry should be just filling teeth and fixing things, and there should be nothing else like that. And that's not our remit. Some people don't want to have the conversation of what's in your toothpaste. They don't think it's important. They think everyone should have fluoridated toothpaste, and that is it. And I'm thinking, actually, we're not fluoride deficient. We know fluoride works topically. It doesn't work systemically. We don't need to be swallowing it. So it's like, okay, can we paste it? It might be a cheap way to reduce it, but could we step back a bit and say, can we talk about diet? Can we talk about snacking? We do simple things at schools and say, well, you don't need to have dessert every single day. There's things that we can put in place. We don't have juices. There's no reason for schools to have juices. We go into so many schools like, just give them water. They don't need anything else. I mean, I remember going to one of my kids' first sports days, and they finished their race and they were giving juices. I was like, why are you giving them orange juice? It's like, they need energy for the next race. They don't need energy. They've had food, okay? They don't need that. It's bad. And then we connect rewards to sugar. And then the whole thing is like, okay, when I'm really tired, I grab the orange juice because that's what I had at school. Yeah. And that was giving me energy. And we know that gives somebody a high, and then they drop down again. So it's like, okay, can we break some of that cycle early enough? And I think young parents are brilliant when they're first kids. They're really receptive to, okay, what do I need to, I've had loads of fillings. What do I need to do to stop my kid having fillings? It's like, okay, well, number one is diet. Breastfeed as long as you possibly can. Diet. Then bringing them into the dentist so they get used to the smell and the feel, and it's not a big thing. And it's like, okay, let's catch things early. Early inceptive orthodontics. Are they a mouth breather? Is there something that would be a risk factor for them? So it's that, I think I really enjoyed that conversation. I think general dentists don't want to have that conversation, or they're not interested. My thing is like, you don't need toothpaste. People get worried about that. It's like, cool, if you tell everyone not to have toothpaste, or there's some general dentists say, well, you're telling everyone to have hydroxyapatite. There's not enough evidence on hydroxyapatite. It's reversal. Fluoride is better. Why are you doing that? They're going to come up with tooth decay all the time. So actually, we're trying that conversation to say you have control over of what you eat, and you have control over what you feed your kids, and having that dialogue. And I feel that I want to make dentistry more accessible to everybody, and realizing that actually we do amazing stuff. We do amazing transformations. You do smile reconstructions. You can rebuild people, trauma and all that stuff. But trying to get rid of some of the misinformation, especially about root canals. And that's the biggest one that gets hit to me, is like somebody comes in, I'm panicking. I've seen a podcast. I've got a root canal. It was done 10 years ago. I'm worried now. I want it out straight away. And I was like, why do you want it out? I've read about it, and it's a dead organ. I want it out. And it's like, okay, fine. So then we do a CBCT, we scan it and say, look, there's no response at all to this root canal. It's done well. There's no response. If you're really concerned, let's do some inflammatory markers. You've got no inflammation in your body. So this tooth, in my opinion, is not triggering any of your symptoms. I agree we don't want dead organs in our body. I agree we don't want to do root canals. Now you've had one, what can we do to stop you having others? We'll monitor this every 2-3 years. If anything changes or you get any symptoms, we'll deal with it. And I think that's what I want to try and look at.
It's the nuance in the argument that's devoid on social media quite regularly.
It's just that one thing, and it's like, what can you do to help? Okay, these are the different things that we can help. And as dental care professionals, we can do so much. We can motivate people, we can help people now, and we can work with our colleagues. And I think that's really fascinating. We get patients coming all the time, I'm sure you do, where they've sort of starting a chemo and they need a letter from us to say they're healthy. It's like, you've done nothing for 10 years and suddenly you want us to give you all clear. Okay, well, let's
next week.
Yeah. But that, at least the medical colleagues are thinking about the connection and what's going on. So I think that's developing and growing. And there's a lot of this biohacking and people reading about, a big thing is mouth rinsing and using oil pulling. And people, I don't know what your thoughts on oil pulling are, but there's a whole thing of, I've been oil pulling.
I think it's probably at the bottom of my pecking order of importance. I'm obviously very much against traditional mouthwash in terms of nuking all the microbiome and the negative impact of that.
If we get patients who come in and say, I oil pull for 20 minutes, it's like, and you haven't flossed or brushed your teeth, and they think that's going to get rid of it. And I'm thinking, okay, there is some evidence to say improves breath, but there is no evidence to say it improves perio. If you're going to spend 20 minutes doing something, why not spend
20 minutes flossing? Would be great.
2 minutes flossing and brushing your teeth, and that's got evidence to it. So I think that's something that I want to try and get rid of, some of the misinformation. And
well, a contrarian opinion will always outperform on social media. That's the issue that we're up against. In terms of the root canal conversation, I take a lot of CT scans for implants, etc., and I see a lot of periapical radiolucencies apically, oftentimes in the maxilla, associated with quite significant hyperplasia of the membrane and the sinuses. What's your view on that as a, I don't know what to call you now, a dentist? A holistic biological dentist.
So we find loads of those, and I've not had a CT scanner till 18 months ago, and now when we're taking them, we, as you say, we see loads of them, and the patients don't realize it, and you go like, this is a significant problem. And then they start telling you they've had a postnasal drip, or they feel a bit generally unwell, or they're always going to their doctor about different coughs and colds, and realizing that actually this is an issue, and then we need to take the tooth out. Usually trying to retreat them is quite tricky when they've got significant disease going on. So majority of the time we take the teeth out, we're really careful. We usually get a CBCT report to see what's going on with the sinuses, and then maybe speak to our ENT colleague about, because we don't want to get a perforated sinus or any issues with that. But we find that they resolve once they're taken out. So we are taking, if they've got areas on the teeth that are that significant and they're causing issues in the sinus, then yes.
And in the mandible, for example,
so
post-RCT.
It depends on how big it is, and then also it depends on whether we've got any previous scans at all. So if they're completely,
progression is your concern.
Progression is a concern, and the size of it and the proximity to the sinus is the issue. And I think we find some really big lesions and we take them out and they are smelly and not nice. And that's my worry. And again, sometimes these people have these for years and years and years, then become systemically unwell. They get flu, they get something, and it triggers and gives them issues. So when they're that big, we usually go in and take them out.
Interesting. And then on the fluoride conversation, just go back to that one briefly.
That's the one I get the biggest trouble.
We're bouncing around a little bit here.
It's fine. The fluoride I get in the biggest trouble from dentists. They go, "You're cracked. There's not enough evidence."
It's a religion.
Yes.
So obviously, Parla has fluoride in it, and
we had that conversation.
We've had that conversation many times. Yeah. I'm yet to see any research showing any negative health outcomes from fluoride in toothpaste.
Okay.
I've seen, and I say I might not have seen it.
Yeah.
I've seen the research on the Harvard studies on reduction in IQ in water fluoridation.
Yes. And neurotoxicity in children.
In the water fluoridation.
Yes.
So in ingestion.
Yes. But we don't know when they're because most of those patients are having toothpaste as well.
Okay.
And fluoride toothpaste. So we don't know, is it the fluoride toothpaste? Is it the water? Is it just the total load of fluoride? We don't know what it is. And there's no...
So run me through your thought process there.
So we're not fluoride deficient.
Yes, yeah, 100%. I get that. I get the ancestral point of view, and
Yes.
I'm on board with that.
Yes,
but we're also living in a modern world with modern diets.
Yes, and there's more.
And mouth breathing.
Yeah, and I'm more worried about the microplastics in our water.
Yeah, agreed.
And the hormones and things. Free, yeah. So I'm worried about all that. So most of the UK is not fluoridated. So in the UK, we've got fluoride in our toothpaste, and that's where majority of people get fluoride in. We know that swallowing it doesn't cause any benefit at all in teeth decay. We know it's a topical effect. Mm-hmm. So therefore, can we not use it as topically and spit it out? We don't need to be swallowing it.
Yeah.
The evidence that I've seen, and again, this is from IOMT, is all about just fluoride, and they don't talk about fluoride in toothpaste.
That's my issue with it, yeah.
It is just fluoride. So my thing is, well, do we need fluoride? We don't need fluoride. So it's like, we don't know whether it's coming from the toothpaste or it's from the water or it's from your diet. But we do know that it is a neurotoxin, and they have shown that.
I know, but there's so many things in life that are toxic at a certain dosage.
Level. Yeah, I mean, water's toxic at the right level.
Like a banana will kill you if you eat like 15 of them.
But we don't. The thing is, I've got so many patients who don't use fluoride toothpaste, who don't use any toothpaste, and they are healthy, and they don't have tooth decay.
Yeah.
And we don't need it. So that's what I'm saying. Well, okay.
But what's the risk though?
The risk...
I just think it's a hypothetical risk based on the fact that it's a toxic ingredient that...
Well, same with the mercury in the filling. The risk of it...
Well, no, because the risk is really obvious there.
Yeah.
And we know that obviously the risk is primarily in removal, but...
Yes. You can measure that. You see, you can't measure the toothpaste, and you can't measure somebody's level. And I haven't seen any studies that show that measures how much they're ingesting.
It's a slight reduction in IQ is the only negative impact that I've seen.
Yeah.
Like what else?
I've seen some papers on ADHD. So I've seen some papers on they're saying that more children with ADHD, but again, they can't prove because they've got diet and all the other
mouth
things.
Mouth breathing as well, probably.
Yeah. So there's so many different things, but I'm saying, and I'm not saying to people, I'm not anti-fluoride. In a way, I'm anti-toothpaste because I don't think you need it. I think
you're pro good diet, and you're pro doing the right things. Let's not put a bandage on it. Let's actually fix the problem.
Yes, and I'm not pushing, and I'm not negative about fluoride. I'm negative about toothpaste, and I'm saying if you're going to choose a toothpaste, choose one without titanium dioxide in.
Yeah.
Choose one without SLS. Yeah. Choose one without colorants and flavors you don't need.
Yeah, and then you know how to finish the sentence, don't you?
No,
and then choose Parlour. That's the ad. Clip it.
Yes.
We got it. We got it, guys.
And then also hydroxyapatite is safe. It's naturally in our teeth already.
Yeah.
So therefore, why would I not use more of natural chemicals rather than use artificial?
I agree.
I
don't disagree.
And I think
it's just the karyogenic effectiveness of hydroxyapatite is we've got a good piece of research now. This 18-month randomized double-blind controlled trial.
Yeah.
When it's over
10%. Yeah.
I guarantee you, most of these brands out there that are marketing against hydroxyapatite, it's not a 10%.
Yeah.
It's going to be at 0.1%.
Yep.
Because no one's checking, and they're trying to make money, and they're venture backed, and they're trying to.
All the hydroxyapatite toothpaste, including Gutology, we work with Gutology a little bit. They're all looking at putting more money into the evidence because they've realised that obviously fluoride's been around for 50 years or whatever, and we haven't got the same evidence, we haven't got the same history on hydroxyapatite, and I think that's where it needs to go. We need way more evidence. There's loads of stuff about glycerine in toothpaste and whether that stops hydroxyapatite working. And there's all this misinformation about it. But if you go right back to the basics of, okay, why are we using this toothpaste in the first place? That's where we should go. And I think if that doesn't cloud the judgment, and I think dentists have a go at me with the fluoride stuff and that, I'm trying to stir them up to make them think a bit more.
Let's have a bit more awareness. Yeah.
I think that's it. And
it's first principles thinking, and I'm fully aligned with that. And as I say, one of my main focuses with this podcast is strong opinions loosely held.
Yeah.
And I certainly live my life by the same ethos that you're using in the fluoride discussion.
Yeah.
which is, we didn't need this thousands of years ago. Why do we need it now?
Yeah.
The problem is the world that we live in now, with the diet that is around us, and the challenges that even someone like me who eats a very whole food based diet, well, the soil is dead that it's being grown in. Yeah. It's being rinsed with a load of pesticides that I'm furiously trying to wash off. Yeah. What's the impact of all of that? There's a load of pollution in the world, and therefore I'm probably mouth breathing because my nose is full of crap.
Yeah.
Like, so we, again, I'm all for decisions that are moving me towards an ancestral way of living, where I can see that there's a potential threat. Yeah. I just don't see the threat with fluoride. Yeah. I just see a hypothetical toxin at a high dose. Yeah. And I think my view is there's been an extrapolation of that. Yeah. And obviously the warnings that you have to put on the back of these packages are pretty alarming, right? Yes. Like, if you eat too much, please consult your doctor is not a positive message, is it?
But I think that when we talk about to our patients, the ideal food, it doesn't have a label. So the ideal toothpaste, in theory, doesn't have a label because it's made from real food.
As close to natural items as can be.
And I think that's what we're trying to go. And if we go back to that, that's great. But
there's just no active ingredients, though, which are completely natural.
Yes.
That's the problem. Because that's what I'm searching for with Parla. And I know we're joking about me talking about it all the time, but it's relevant here. Like, take everything out that we can. Anything I don't need in here, get rid of it.
That's the same in dentistry with all our stuff. What do we need? And if we go back to getting the relationship with the patient, finding out what really matters to them, fixing that one thing they came in for, but then diving down into the history. And like, I want you as a patient for years. I know your family history has got cognitive decline, Alzheimer's, things like that. What can we do for you? Well, we know that sleep is one of the biggest things that helps the brain regenerate and stops you having all these different other issues. So let's work on the sleep. What can we do about that? Is it just stress reduction? Is it the 90-minute wind down that we can help you with? Is it an overnight sleep test to actually see that you've got sleep apnea and we can refer you to a colleague and that would help the quality of your life? Is it the fact we're encouraging you to have some blood tests, see what's going on? We find you're pre-diabetic. And can we then talk about continuous glucose monitor? Can we have that diet conversation? Or can we just write to the GP and say, well, actually, I was about to do some implants for Mrs. Jones and I found that she's pre-diabetic and I'm worried about this. Can you start looking at it? And I think that is where we can have the biggest impact with our patients. And I think the conversation gets a bit blurry when you go, am I biological, am I holistic? Do I believe in fluoride? Do I believe in this? I believe in food. I believe in trying to help our patients get better. Patients, and I enjoy that conversation. And I enjoy the conversation when somebody gives me a list of 30 supplements they're on. Okay, why are you on those many supplements? What's it? I took this one because I was on a Huberman podcast. And I took this one because of this. And I was worried about my sleep.
You stopped disclosing our appointment.
And you put all these different things on. And then they go, why are you on so many? And they go, well, I don't want to stop because I think it might screw up my sleep. And no one's looked at it all. And actually, just stop it all. And just go back to basics. And I think that's what I'd like, because there's a lot of people that are worried about health and wellness. And again, that's what sells shows and things. That like, you've got to take the one supplement you need to take is magnesium glycinate. Otherwise, you're going to have problems. And I think I'm enjoying understanding a bit more about, and I don't know enough about all the different supplements. Now people are talking about peptides and going, okay, and in dentistry, they're starting. Yes, they're trying to put peptides, but they're like injecting different things that have not.
BPC 157 in links with perio and stuff, right?
And there's all these different things out there, and it's like, okay, you're talking about peptides, you're talking about infusions, but you're not using any interdental brushing aids. Okay.
That is a perfect representation of where we're at right now.
I think that's what I want to go back to, and just empower the patients and have some humor in it and say, look, okay, we all want to biohack. We want to do these things. We're looking at photobiomodulation. We're doing all these different things that we can help. However, let's go back a little bit to the basics. Let's do that. Good quality dentistry is the most important thing. Good diagnostics, good baseline radiographs, baseline metrics for our patients, and then seeing what we can nudge, and then developing out your network with a sleep psychologist, whether it's a behavioral scientist, whether it is nutritionist, a GP, all these different things you can help. Maybe my wife's a psychotherapist, so having a psychotherapist in there just to work on stress and things like that. How can you help your patients? and they love it when you send them a link to something. I've got an IQ test that I've sent to somebody who wants interested, or I can send them a discount code for a continuous glucose monitor or something like that. All these little health wow things that we can do to help them build loyalty to the practice, but also getting them healthier and getting them to put more input into what they're doing, rather than just being sort of resistant to the health journey.
Really, really interesting, James. I mean, I could carry on chatting for hours. I think there's so many more conversations that I wanted to have, but I'm aware that you've got to get off for
date night,
a concert tonight. So we'll wrap up. The way I like to finish the pod is to ask you 2 questions about the next 10 years in dentistry.
Exciting.
What do you think is a fad that won't make it past 2026? And what do you think is the future of dentistry, or what you're most excited about that maybe we've not talked about already?
Wow, good questions. Okay, fad in dentistry.
Fluoride.
It's tricky, fad in dentistry. So I think I'm a bit concerned about everyone having saliva testing.
Right.
I'm a bit concerned about this is the one test that everyone needs to do. And I think we're going to use saliva diagnostics a lot more, but I do think it's not going to be for everyone. So I think that is one thing that it's going to be really specific. And I think going forward, it's going to be really bespoke. This is what we're doing because of your history or your story. And I think we're going to make very bespoke plans or journeys depending on the patient journey. And I think we're going to be listening to that journey a little bit more. I'm really excited I love dentistry. I think that the connection with functional medicine is really exciting. I think that is where I want the whole of the journey to go with. I want the dental care professionals to learn more about food and nutrition. I really think that's really important. I think that's exciting. And I think if we start, the dental schools start teaching this a little bit more and starting to realize that we know our restorations will last a certain amount of time in this environment, but if we change the environment to this, that will make a big difference. I think that's what I'm excited about.
Brilliant. Well, James, thank you so much for coming on.
Thank you.
Where can people find you if they want to find out more?
Tell
them about your book as well, which obviously you've got here, which is raising money as well, I think, for charity.
Yes. So Kick Sugar. Kick Sugar is my cookbook. It's 14 days to reboost your taste buds. And I really enjoyed writing that with a nutritionist. And so if anyone's interested, you can buy it on Amazon. If you look at me, Optimal Dental Health, if you're in Baker Street in London, if you're a dental care professional and you want to come and shadow us or have a look, see what's going on and get it out into your clinic, very happy to help. And I'm old school, so I like LinkedIn. I know you're Instagram.
I love LinkedIn. No, I love LinkedIn. LinkedIn's great.
So come and follow me on LinkedIn. And I love what you're doing with Parlour. I think it's really helping the conversation. And it's nice that a dentist is pushing the big giants to the side.
We're trying our best.
Yeah, well done.
Great. Cheers, James.
So thanks for making it all the way to the end, guys. I hope this episode really gave you a lot of value. If you did enjoy it, then please do share it with your colleagues and hit the subscribe button and like below to help us get bigger guests, bigger value, and really help build this community.